Hi, class. Dr. Linder. Let's talk about tissue repair, how the body regenerates. We just spent a whole lot of time talking about tissues, epithelial, connective, muscle, and nerve. When these tissues get damaged, how does the body repair it? Now, when it gets damaged, most people experience pain, right? Oh, this hurts. This is uncomfortable. So it leads me to help us understand the difference between what we call signs and symptoms, right? So we have signs and then we have symptoms. Pain is a symptom. If you have a headache, that's a symptom. If you feel nauseous, that's a symptom. But symptoms are more subjective. It's the thing that you, the patient, tell your physician. Signs are more objective. These are things that we can measure on you. Maybe we're taking your temperature. Maybe we're taking your blood pressure. Maybe we're doing some orthopedic and neurological exams. We're looking for signs. Maybe we're doing x-rays or MRIs to look for certain features and signs. So signs and symptoms are not the same thing. Symptoms are more subjective, and it's the stuff that the patient tells their doctor. Signs are more objective. They're things that we try and discover through our examination. Now, sometimes, especially with injuries, when someone hurts themselves, well, maybe we need to do an x-ray, or maybe we may need to do an MRI, but you have to know there are certain contraindications, especially to MRI. If someone has a pacemaker in their heart, if someone works with metal and has metal stuck in their body or glass in their eye, very, very dangerous. So they always do questionnaires. In fact, they do these questionnaires. I had a patient that I took care of, I'm going to say almost 30 years ago, and he owned a very, very large radiology office in Nassau County. I won't reveal the town, but a very, very prominent radiologist, very, very close to a major hospital in Nassau County. And there was a patient that went in that was improperly screened. Back then, they really didn't know how to do proper screenings, I guess. Anyway, the person had a pacemaker, went into the MRI machine, came out dead because it's magnet and there's metal in that. And that thing ripped his heart to shreds within seconds once that machine went on. And what ended up happening, this was a patient who was insured by Oxford. And at that time, Oxford Insurance um, would not cover or send any patients his way. So it really did impact his practice, major lawsuit. Now, this is why these days there's such an intense line of questioning. Before I ever send a patient for an MRI, I do the first screen. I'd like to send you for an MRI. Do you work with metal? Do you work with glass? Do you have any implants in your body? And we document properly. Then by the time they go to the radiologist, I already did the first screening. Now the intake forms, they'll ask the same questions on the intake form. Then when you're going in, right before you step in the room, they'll ask again a third time because they don't want this happening. So if there ever has been any type of glass, working with metal, any type of fragments, you always have to let them know before going into an MRI machine. X-ray, not so many contraindications. I know people are worried about radiation that's affiliated with them, but just to give you a general idea, having a full set of X-rays of every single body part in your body equates to about being in the sun for a full year, just to kind of put it in ratio. Okay. So now when someone does hurt a body part, the first sign of healing is inflammation. That's the first sign. And it shows up with redness and swelling and warmth and pain. They all kind of happen at the same time. All of them. That's the first sign of healing is all of these: redness, swelling, warmth, and pain. And that's because of the different type of chemical mediators that are released. But the end result of inflammation is eventually repair and regenerating new cells and tissues. So we go through inflammation so we can repair. All right. So when there's an increase in pathogens or an increase in toxins or an increase in waste products or damage to a sprained tendon or a sprained ligament, right? A sprained ankle, anything, it's going to stimulate the release of mast cells. And the mast cells are going to release histamine and heparin and prostaglandins. Prostaglandins are going to give you pain. Histamines are going to dilate the blood vessel, rushing and bringing in lots of blood to the area. And because heparin is the blood thinner, now blood can rush into that damaged area in a dilated blood vessel. Because blood is 100 degrees in temperature, it's warm. Because it's dilated, you get all that swollen, you get swollen blood in there. You get all that blood, so it swells up the area, and it's red because it's erythrocytes, it's red blood cells. It's trying to oxygenate the tissue, bring oxygen in there to help provide energy for regeneration. So all of those things are going to increase blood flow, increase pain, and increase the vessel permeability to allow the exchange of nutrients in both directions. That's going to increase the temperature, increase the oxygen and the nutrients. You got phagocytic activity. You got macrophages engulfing away debris and toxins, bringing them away and bringing in healthy oxygen and nutrients to the area. Right? So it's kind of like out with the old and in with the new. And at the end, you got regeneration. Normal tissue is restored. So this page is kind of like the take home of what we're going to cover on all these pages, right? So in order to respond to damaged tissues and injuries, right, the body has to go through homeostasis. And it's the balance between inflammation and regeneration. Acute inflammation is good. Chronic, bad, bad, bad. Remember, chronic inflammation results in those MMPs in circulation. Those matrix metalloproteinases or collagenases degrade the tissues. Very, very destructive. So inflammation, which is the tissue's first response to injury, shows up with swelling, redness, heat, and pain. These are the signs of inflammation, the first signs of it. Is something wrong when this happens? Absolutely not. This is the sign of a healthy individual. So it can be triggered by trauma, some sort of physical injury, or an infection. Maybe the presence of a harmful pathogen due to a cut or a lesion in your skin. So the damaged cells are going to release these chemical messengers like prostaglandins, proteins, potassium ions, all involved. Certain cells are going to break down. Remember, you have these lysosomes that are going to release these digestive enzymes. They're going to dump hydrogen and make it very, very acidic to destroy any injured areas around. And when the tissues become destroyed, it becomes necrotic. They call it necrosis. Necrosis or necrotic. It actually becomes like black, deadened tissue. So necrotic tissue and cellular debris becomes what we call pus. It can accumulate around the wound. Sometimes the body creates an abscess when it walls it off, right? The pus becomes trapped and walled off in an enclosed area. We know that the injured area releases mast cells that release histamine, heparin, and prostaglandins. These signal pain and more inflammation. Heparin thins the blood, and histamine is your vasodilator. So it's really going to help to increase the blood flow to any given area. So when you have the dilation of the blood vessels, it increases the blood circulation. When you have more blood there, blood is 100 degrees, so it's warm. It's called red blood cells, so you get the redness. The red blood cells, because of the hemoglobin, carry oxygen and nutrients, and then through the blood, you're going to be able to remove waste through the macrophages. Plasma can diffuse into the area, causing swelling and pain. And the phagocytic white blood cells, they're the cleanup. Now, regeneration, that's when the injured or the infected area is all cleaned up. And when it's all cleaned up, that's when people consider now it's healed or healing, or the regeneration can begin. That's when the fibrocytes move into that area that has the dead cells and tissues, and now they can lay down new collagen and new protein, and they can bind that area together, like especially if it's in the skin, and that's what you call the scar tissue that forms. Now, some people have excessive amount of scar tissue that forms and becomes prominent. We call that a keloid. New cells can migrate into that area for regeneration, but not all cells can regenerate, right? We know that epithelium and connective tissue, those can regenerate pretty well. But when someone has lack of oxygen and lack of nutrients to the heart, or when you have lack of oxygen to the brain or your neurons, when those things start to die, they cannot regenerate. Okay. You can manufacture new ones, but the ones that are dead cannot regenerate at all. Okay. Other parts can pick up for the slack, right? Certain parts of the brain, when they die, you can have other parts that kind of pick up on the slack of that. When someone has a myocardial infarct or a heart attack, when that has decreased oxygen, forget it. Those heart cells, they're done. It really does look black, necrotic, and dead. So here you've got the mast cell activation. And when that happens, mast cells release a variety of those chemical mediators that we see over here. And that's needed to thin the blood, dilate the blood vessels, create more inflammation and pain. All right, so that's what happens. Increased blood flow, increase the permeability, and increase pain signals. And as a result, we have the increased temperature, because we know blood is about 100 degrees. You have increased oxygen and nutrients being delivered to the area. The macrophages come in, those white blood cells come in, and you got phagocytosis happening. And you get the removal of all the toxins, the dead tissues, everything that needs to be removed is removed. And that allows for the regeneration to take place. And what ends up happening with regeneration, you get the normal tissues that are restored, and the body is maintained in homeostasis.